44-year-old man presents to the clinic for evaluation of difficulty swallowing for the past few days. He says that he's noticed progressively worsening chest pain when he attempts to swallow solids or liquids. He works from a home office. He has not had any recent sick contacts and he's currently not sexually active. He is HIV positive with a CD4 count of less than 100 and his lab testing 1 week ago. His current medications include emtricitabine, rilpivirine, and tenofovir. His temperature is 100.6, pulse 72, respirations 18, blood pressure 136/84. A physical exam is notable for dry mouth with red mucosa and no distinct plaques or patches, and a supple neck with no masses or cervical lymphadenopathy. EGD shows small white patches within the esophageal lumen. A biopsy of one of the lesions is performed and microscopic appearance is shown below. Which of the following is the most likely diagnosis? Is it CMV, esophagitis, eosinophilic esophagitis, esophageal candidiasis, herpes, esophagitis, or medication-induced esophagitis? So this is a very high-yield question. You're going to need to know how to differentiate between the different kinds of esophagitis. Straightforward question, but high-yield point. Very straightforward question, but you need to be able to differentiate between the different types of esophagitis. Okay, so a majority of the esophageal candidiasis cases are caused by Candida albicans, occurs in immunocompromised patients such as those taking steroids, chemotherapy, or HIV positive with CD4 counts of less than 100. The absence of oropharyngeal candidiasis will not preclude the possibility that infection is present within the esophagus. When the infection is limited to the oropharynx, where candidiasis can be differentiated from leukoplakia based on the ease with which the patch can be scraped off, treatment involves non-absorbable topical antifungals like nystatin. Okay, this is the swish and swallow technique. Because esophageal candidiasis is considered more invasive, systemic antifungal treatment is required. When these patients present with dysphagia or rhinophagia, the patient can be treated empirically with antifungal, but an EGD must be performed if symptoms do not improve in 3 days. If the patient does not have thrush, then EGD may be performed sooner if the etiology is unclear. Coming to CMV, CMV is another cause of esophagitis, occurs in AIDS patients, again CD4 count of less than 100. However, the main thing to remember about CMV is that it appears as linear ulcers of white plaques or patches on endoscopy. So CMV has linear ulcers. This is a very, very, very high yield association you have to remember. Okay, like other pathologies that involve eosinophils, eosinophilic esophagitis occurs again in atopic patients when allergens such as food or stomach acid interact with the esophageal mucosa. Eosinophils are released and they release compounds that lead to esophageal rings and symptoms of dysphagia that don't respond to PPIs. This is another very high yield point, eosinophilic esophagitis, atopic patients. You will see esophageal rings. That is very, very characteristic. They will present with dysphagia and they do not respond to PPIs. So this is an extremely high yield point. HSV, again, a cause of esophagitis, typically HSV1, multiple punched out ulcers as opposed to white plaques or patches. Very high yield to know that HSV, multiple punched out ulcers, and medication-induced esophagitis can occurs when patients attempt to swallow medication, but the medication lodges in the esophagus, has caustic effect. So the thing to remember with medication-induced esophagitis is the medications that can cause it. The one I would recommend really remembering is the bisphosphonates. Very, very high yield association of bisphosphonates with medication-induced esophagitis. That's why we have to tell the patient to take the medication with water and sit upright for 30 minutes after taking the medication. Because if they don't, there's going to be higher chances of esophagitis. So this is a super high yield question, not just because Candida is the right answer here, but why the others are wrong and what would help differentiate Candida from CMV, HSV, pill esophagitis.
Thanks for watching. Please give a thumbs up and subscribe for more.